Here's the surveillance data. So this is another one that you might have to do, it might be a required one, is the capability to submit electronic syndromic, am I saying that right? Okay, it doesn't matter. Surveillance data to public health agencies and actual submission in accordance with applicable law and practice. And then read again the note, unless none of the public agencies to which an eligible provider submits such information have the capacity. So again, if the regional area that you're going to be submitting this information to is not ready yet, then you qualify. So I kind of think that the last two are kind of gimmies because I don't think they're going to be ready. Site must attempt to identify one public health agency which whom to conduct a test of the submission of electronic data. The test must include the transfer of either actual or dummy data. So you just have to test it. It's an attestation. It's either, it's just if you did the test or if you didn't do the test. It's not even if you passed or failed. So here again, this is just saying that the CMS will accept a yes/no attestation to verify this test was performed. So it's not asking if you passed it, it's just saying if you performed it. So that takes us through the core objectives and the menu requirements. Action items. Study the meaningful use criteria. So that's one of the things that we want you guys to do now. That's what this action items is talking to you guys about. So look over everything that we talked about today with the core objectives, with the menu items. With the menu items specifically, you're going to want to take a look at those and pick which of the 5 you're going to do. With the clinical quality measures, you're going to want to pick the 3 in the back of that book that we gave you just to see which ones fit your specialty and your practice to make sure that you have that set up. You're going to want to basically take from all that information that you did today, you're going to want to conduct a self-assessment to determine how far off you guys are. Or maybe we need to implement e-prescribing or order entry, or we need to get a patient education or webview, yada, 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 so that you can get that going. That's what I just talked about. And then you need to get it, so you need to maybe have it set up so that you can upgrade to the ARRA certified version of the EHR. We made that as generic as possible for Practice Partner and Medisoft Clinical and Lytec, so 9.5 basically. Establish a time frame and goals for meaningful use and compliance. So when are you guys going to put this into action? When are you guys going to start measuring everything? That's probably a good thing to have mapped out with you and your staff so that you kind of have a common goal set aside there. Also, you're going to want to conduct self-audits prior to your trial, so you want to make sure that everybody is recording that data into the system the way that you're going to be reporting on it. So if you're putting that information in through ICD-9 codes into your problem list, you're going to want to make sure that no one's just texting that in saying diabetes or DBM or anything like that. Also, you're going to want to educate and involve the staff as much as possible because a lot of this information hinges on them putting that into the system. So if they don't understand why they're putting that in, they just think it's another nuisance, that's probably something that's not going to be put in the system. So at least that's what I think. So that's why you want to educate and involve the staff. And then you're also going to want to assign subject matter experts and advocates. So when you're talking to them, there might be an e-prescribing expert or a webview expert in the clinic. You might want to have those people set aside so that if there's a question that comes up on one of those systems, they can go to that person and talk to them about that.